Question number 8. A nurse is assigned to care for a patient in medical ward who has a physician order of 1500 milliliters of normal saline 0.9% to be administered over 12-hour period. Which of the following is the infusion rate? A. 75 milliliters HR. B. 100 milliliters HR. C. 125 milliliters HR. D. 150 milliliters HR. The answer is C. 125 milliliters HR. Question number 9. Doctor ordered to give 75 milliliters per hour over 12 hours of normal saline. How many ml total should be given? A. 450 milliliters. B. 600 milliliters. C. 900 milliliters. D. 1000 milliliters. The answer is C. 900 milliliters. Question number 10. A 25-year-old woman present to the emergency room with decreased reflexes, hypoventilation, hypotension, and fused pupils. A family member who is accompanying the patient has bottle of diazepam, which the label states was recently. The family member also indicates that the patient has a depression. What intervention should the nurse expect to administer? A. Naloxone. B. Active charcoal. C. Tap water enema. D. Magnesium sulfate to reduce the risk seizure. The answer is B. Active charcoal. For complete study materials and other assistance, contact Nursing Manthra through WhatsApp on 9715025155717. Stay tuned for more videos.